So last week I talked about just nurses in general and how they're not very appreciated in the hospital and just their job overall. So this week I'm going to talk about an RN versus a BSN, which is registered nurse versus bachelor's of science in nursing. Um, Essentially they're both the same thing. They're both RNs. Um, a nurse who has a BSN just went to a 4-year college and went through and has a bachelor's degree, whereas a registered nurse only did an associate program, so they only have an associate's degree, or they even did a program through the hospital, which is basically the same thing as going to a junior college or going through an associate's program. Registered nurses who do not have a BSN cannot have an education role for nursing. They can't be unit or department coordinator roles, and then they can't have management positions. So, oftentimes in a hospital, you'll find nurses who are like the unit nurse or the floor nurse, and most of those nurses have BSNs. There's very few nurses who are just RNs and do not have a BSN, and they're most likely older and have been there for several years, and so that is why they've worked their way up to that. Whereas new hires, especially like right now in today's age, they're most often required to be a BSN. It's BSNs have had during their nursing program when they did clinicals during college. They had better patient outcomes, lower mortality, and lower failure to rescue rates, according to the American Association of Colleges of Nursing. So, BSNs were able to participate in more clinicals and get more hands-on with patients and have doctors and nurses who had been in the field longer to help them and show them through everything so that they were able to do it correctly and not screw up. Everyone's going to screw up no matter what, and then sometimes when patients pass away, it's not your fault at all. It's just something happened that we couldn't control. And so, but associates programs that nurses go through oftentimes don't have that help that can help them show the right ways to go about addressing a patient who is dying. And so, in a way, RNs aren't as prepared who just went through an associate's program for when situations like that come about. Like I mentioned earlier, a lot of hospitals nowadays require newly hired nurses to have a BSN. I know that right now our director of the nursing program here at school has told us that most hospitals outside of the Permian Basin will not hire us just because we are right outside of college and we don't have much experience. But even the hospitals around here mainly require us to have a BSN. And if you want to climb the chain, so to say, in your career, the higher of education you have, the better chances you are of getting a raise or continuing on with your career. Because when hospitals have cutbacks and have to let people go, RNs without BSNs are the first ones to go. So it goes for LVNs or any lower ranked, or I guess lower educated nurses who did not go through the bachelor's program. Not saying that they're not as smart as BSN, but they just did not have as much education. So the hospital would rather have someone who is more qualified for the job, especially when they have to make cutbacks. And I know a lot of RN programs who you can go through 2 years and get your RN and then do another program for just another year for have your BSN. So it's safe to say that just to go ahead and get your BSN because it pays off way more in the end.